So here we also learned something about health literacy and digital literacy, and that we have to use different terms. But it's very important to understand that health literacy is important to facilitate self-management. And the next title for the next presentation is Self-Management Needs Health Literacy. But how good is health literacy? And there is no one who is more literate than Dr. Doris Schaeffer, because Mrs. Schaeffer, you have been a professor since 1997 at the University of Bielefeld, and since 2018 you've been a senior professor, and together with the Robert Bosch Foundation you developed the National Action Plan for Health Literacy, and you carried out many studies about this subject. And now we can listen to your experience, and we're happy that you're sharing your vast experience with us. The floor is yours, Mrs. Schaeffer.
Ja, vielen Dank für die nette.
Thank you very much for this invitation and for your introduction. I was about to thank Mrs. Lorik, but I don't see her. Well, I was very moved by her presentation. First of all, I wanted to tell you how I ended up in this field of self-management and health literacy. During my professional career, up to this day, I was dealing with the management of chronic conditions, and I was always doing that from a very personal perspective, because I actually came from qualitative research, and we always looked into the management of different challenges that go hand in hand with chronic diseases, and we always found out that there was a lack of support. That was my starting point. So I was trying to look into different interventions to support these people. In Bielefeld, we looked at case management for a long time, then self-management, and then heard about the first data of health literacy. And then I thought, this is really the bottom line. This is the solution. And we took a look at the first data from the European study that was carried out and presented in Brussels. And we thought, if we were to promote patient education, which in my opinion is the overarching topic of this symposium, we have to also take a look at health literacy and the data related to that. That was my personal motivation, to take a look at health literacy. And that was also my motivation to go into research. On top of that, the first initial European-wide study was carried out, and only North Rhine-Westphalia, the German federated state, was participating, and not Germany as a whole. And that was my intrinsic motivation to take a look at research. But let's take a step back, because someone asked me to present the concepts of Mrs. Marie-Louise Dirks, and this is what I did. Unfortunately, the presentation does not work. I can't. So there seems to be a technical hiccup. That's the wrong presentation. Okay, nevertheless, I'm just going to continue. Maybe we will see the right presentation later on. Oh, there you go. There it is. Mrs. Lorik, you're finally back. Let me just thank you. Thank you so much for your presentation. And also thank you for taking a look at the German National Action Plan, because usually we have to take a look at American literature. It's always great when we see it happening the other way around. Thank you so much. So we heard definitions about self-management already. Mine is slightly different, but there are some similarities. Self-management with regard to chronic conditions is about fostering capacities for an active, self-determined management from the point of view of the sufferers. and deal with the problems and decisions that are necessary for the people affected. I included the term decisions. Mrs. Lorick might not agree with that, but I actually learned from Mrs. Lorick that self-management also means the perspective taken from the patients, from the sufferers, and I think we have to keep that in mind. I think self-management is quite different from other intervention because it's adopting the point of view of sufferers. And we just heard about the psychological and social skills earlier, and so I would just use this as an umbrella definition. So health literacy only refers to the ability of people to deal with information that are necessary to make viable decisions so that their health benefits from that. So health literacy is a more restricted concept, and it's focusing on something else. It's about the management of information. So self-management is quite a broad interpretation of things, and health literacy is a more restricted definition. Self-management cannot work without health literacy and without the ability of managing information. So health literacy is an essential component, or it's maybe also the basis, which might be questionable, but it's at least a component of self-management and self-management support. So where did we get these concepts from? Well, they have to do with the changing roles of patients, and they're also based on the independent movement of the 1970s, and that movement tried to go away or to move away from that patronizing dealing with patients to acting to a more self-determined manner. So we want to have the so-called informed patient, and I think that's a great metaphor we can use. And information becomes more and more meaningful in this context. In Germany, as well as the entire world, we can observe a lack of information, or at least in the past. When we founded the Independent Patient Counseling in 2008, that was actually a reason why it was founded. They said there was a lack of patient information, and this is why they established this counseling point. And I believe this is actually a thing of the past now, because due to digitization, we can see there is more and more information around, accessible to everyone at any given point. We have more sources of information that are available for us. And we also have specialized information as well, and which are basically accessible for everyone. But there is a downside to that, and we are very well aware that since COVID and now in the Ukraine war, we can see that misinformation has increased, dangerous information, manipulated information, and we have seen many people that are not experts in their field spreading information, spreading misinformation. So we have changed the approach of managing information. Today, it's not about self-determination anymore. It's about using the momentum of our digital information society and its implications. So in my opinion, information management has become more important, as well as digital health literacy or information literacy. So how can we implement that? And I would like to present some data to you. So I'm going to deal with facts now, not with funding issues. I'm going to focus on the last health literacy study that was carried out by us, the HLS GER2 that was published last year, which was a follow-up study to the European study, and it was a German-wide study that was carried out, and it is actually part of an international study, HLS 19, led by Jürgen Pelikan. 17 countries participated, and we just published the report at the beginning of 2022, but I'm going to focus on the German national data now. And the most important finding is represented here. You can see that in the bigger cycle, or bigger pie chart, and 58.8% of the German population have a very low health literacy. So they have difficulties managing, finding, understanding, judging, assessing information about health. Unfortunately, we came to the conclusion that the health literacy has worsened. If we take a look at the past development, I know not all of the studies are comparable, but we can see that since the first study was published till today's study, we see that there is a downward movement, downward development. The first study that was published showed about 46% of health literacy. And then we actually drew a comparison with other studies, and we saw that the actual number is even higher. So we are at about 60% of health literacy in Germany, which is a quite concerning development, or it should be concerning for us and for political decision makers. Health literacy is distributed quite unequally in Germany. This was something that was stated by the first study already, and we state this as well. Low health literacy is impacted by low level of education, low social status, and a higher age. And you can see that those with a low level of education, we have a share of low literacy at 78%, which actually should be quite concerning for everyone in the room. Just like the low social status, here we have a share of low health literacy at about 72%. So we identified a problem that is actually affecting the lower social strata of Germany and also the higher age, but here this share does not seem to be as significant. And we observed two developments that I would like to point out now. We have different shifts. In the first study, people with a migratory background were part of the vulnerable groups. Also, with people with chronic conditions were part of this group. And here we observed a shift. If you take a closer look at the data, and if we saw that people with a migratory experience and or background have a great share of health literacy. So people who had to flee or escape from a different country, which is quite relevant for today's situation. And in the lower line, you can see that people with several chronic conditions, I wouldn't refer to it as multi-morbidity. I would just like to talk about it as several chronic conditions have a share of 65% with lower health literacy, which is a concerning data as well. These facts and figures are quite meaningful with regard to interventions, because we should be focusing on the group with several chronic conditions, as there is a great lack of health literacy. So what is difficult for people with regard to processing information, finding, understanding, assessing, and applying information? The answer is quite straightforward. You can see the red colors here, and you can see that assessing information is most difficult for people. The share of low health literacy is quite large. And people who suffer from several chronic conditions find it even more difficult to assess data. And you can see there's a slight difference in these different bars. I'm not going to dive too deep into these data. I just like to point out the fact that especially people suffering from several chronic conditions have difficulties. So what does this mean if you have difficulties assessing information? It means that information is not received in the right way, is just being blocked by the people, or you can't really absorb it into your own knowledge. If I can't assess information, I can't absorb it into my own state of information. Secondly, this means information is not being applied. You can't use these pieces of information. So the information does not have an impact or make a difference. Secondly, I would like to point out that there are differences, or there are no significant differences between the vulnerable groups. So when I talk about people with several chronic conditions, they account for the same share as the general population, so that we don't really see large differences in these different population groups. But as I said, assessing information seems to be the biggest problem for every group affected. And this has a great impact on processing information. I think I already outlined that. So what's difficult for people? Let's take a look at the first items on this slide. It's assessing the advantages and disadvantages of different treatment possibilities, and whether or not should I get a second opinion of another physician. This should be concerning for us because I talked about the changing roles of patients. I myself, as a self-determined patient, should really be able to do these two items that I just managed. If I have difficulties assessing information, it means that we cannot promote the patient's role, rather we impede the patient's role. This also applies to the second item, using the information provided by my physician in order to make my own decision, my informed decision with regard to my personal disease. Once again, we should be concerned about this. Those items that deal with the traditional role of the patients, so following my doctor's advice, seem to be quite easy for patients. But once again, this goes to show that assessment is important and we should work on that. It's very important with regard to fostering the role of the patients, because we want to foster self-determined, actively acting patients, or at least that's the goal that we set for ourselves. We want to become that self-determined patient. Let's talk about digitization. Mr. Schwarz explained to us that digitization is improving, that we have a digital transformation in our society, but let me quote one of the surveys carried out by the Bertelsmann Foundation in 2018. We have not found new information on this issue, so I don't think that there have been any significant changes. With regard to digitization, Germany seems to still be lacking behind and still needs to catch up. This is a political issue, and let's keep this in mind when we take a look at the data. Let's take a look at the use of digital offers. Here we also took a look at those suffering from several chronic conditions. I would like to point out 2 to 3 things. So when you take a look at web pages on health information, we can see that people access these web pages. About 60% use them, but 30% of the population do not attend these websites. And people suffering from several chronic conditions, we can see that only 40%, or that 40% do not take a look at these web pages. Social media. 62% of this group do not use social media, or 70% of people suffering from several chronic disease do not use social media. Let's take a look at digital devices. I don't think I have to read out all of the facts and figures, but the non-use of digital media or gadgets is quite significant, and also the interaction with health providers are not being used by 85% of the population, or they have not had any experience. So we can see 3% more with regard to people suffering from several chronic conditions. So this points out low health literacy, and it also goes to show that we also have issues in Germany with regard to the accessibility of these digital formats. We also collected COVID-specific data 1 year after the pandemic, and we can see that there is a slight improvement. So we can see that there is an abundance of health-related information that was provided during COVID, and that led to a slight improvement in all of the areas that I already presented. Let's take a look at the digital health literacy. And that looks even worse than the general health literacy.
Here we can see a share of about 76% as far as the general population is concerned, and 78% of people with chronic conditions. So the difference actually is much smaller when it comes to digital health literacy. But in general, we can see that we have a high percentage of people with a poor digital health literacy. So definitely there is a need to act, and this is not only due to the individuals, but it is due to the structure as such. And again, we added 2 more points regarding judgments, making a judgment whether any information found can be really trusted. This shows that we need a structural intervention here in order to improve the quality of information. We need interventions to boost trust and to improve evidence. Let's take a brief look on the social distribution, so that we need to find out on which group of people we have to focus. Again, we have a high percentage of people with poor digital health literacy, and the highest percentage is among people with poor education and people older than 65 years. And also people that are disadvantaged regarding their social status. So not all people are equipped in the way they are supposed to be. So the problem is that promoting digital health literacy under Article 20K will not be able to solve this problem. And now I would like to talk about navigational health literacy. This is very important to people with chronic conditions. It's very relevant to them because they need to know how to navigate information related to health. And here again, the share of poor health literacy is quite high. Mr. Schwarzer has just told us that the German healthcare system is very complex, very hard to understand, and this applies even more to people with chronic conditions. They face more obstacles to navigate the German healthcare system, and this is not about literacy as such. It is rather about the fact that they are very well aware of the problems of the German healthcare system. I won't go into detail here, but again, it illustrates very well that we are facing a number of challenges regarding making a difference to the role of the patient. So our studies confirms what American studies have already found out. Poor health literacy will lead to unhealthy behavior. US studies have shown that this also means a less ability to benefit from self-management. So I would like to sum up the social importance of health literacy. So it's getting more and more important, but at the same time, health literacy in Germany is getting poorer. And according to the study that I've mentioned, we are ranking. Our ranking is very poor. Digital and navigational health literacy comes off even worse. So health literacy is very strongly related to the educational background, social status, age, a migration background, and the existence of several chronic conditions. And this is what we need to have in mind when trying to promote health literacy. The question is whether these people are still a vulnerable group, but we think this group is mainly a group that is at risk, showing poorer health literacy. What is particularly difficult for them is to judge how reliable and objective information is that is provided online. So promoting health literacy is an important mission of our society, and this also applies to self-management. What we are talking about here is evidence-based information, but it's not about the content only. Health information needs to include more information on how to solve health-related problems. And this definitely is a challenge that we are facing in Germany. But these interventions also have to focus on improving our healthcare system. We need good and easy access to reliable health-related information and support to navigate through this information. And promoting health literacy and self-management need to maintain throughout the entire chronic disease. We need more sustainable investment in order to promote health literacy and self-management in the long run. And Marie-Louise, I definitely think we have to try and find, well, a new path here that we need to embark on in Germany. Thank you very much.